So right now we all are hearing the unfortunate news about Kevin Samuels um, no longer here, secondary to a cardiac complication. And I know all the different platforms that are much larger than mine are discussing this from different angles. But I just wanted to jump on and just reiterate the importance of us taking good care of our hearts, especially now. And the main reason why I wanted to say something is because over the past 2 days, I get a lot of patients from online. My TikTok followers, and I want to say friends, but and so many of my new patients are explaining to me the reasons that they are not taking their medication that was prescribed by their doctor. And after we go through a conversation and I explain, they're like, well, that makes sense because everyone feels as if they know their body, and I respect that, and they feel as if they know what's best for them. But the problem is, we are not taking into consideration what the sea has done to us internally. Even if you were not infected with the mm, you are still affected. The reason why is just because of the isolation, the financial distress, just the controversy. The world is like its finger is in a socket, and we're all caught up in the middle of that. And also, everyone is probably trying to catch up, trying to get back on their feet from prior, and our circadian rhythm is off. What we have to understand is there are neurotransmitters that allow that little machine in your chest called the heart to beat on a regular basis. It started 27 days after you were conceived. So basically, your heart started beating before your mother even knew that she was pregnant with you. And it has not skipped a beat. And we eat various food that may cause a dysrhythmia. We gain weight. We take medications. We drink things. We deal with stress. If you internalize stress, you feel it. How many times have you been in an argument and you said you just felt your heart going fast? Your heart reacts to everything that is in front of you. And we have to get it evaluated, especially once we get over 50 years old. Once you get over 50 years old, all those things that used to give you that extra stamina, they start to get a little bit tired. I mean, you've been here for like half a century. You have to respect that. I understand the fact of insurance being an issue. And hey, how are you? I understand the fact of insurance being an issue. Yes, yes, my dear, it sure can. It sure can. Ask about Red Bull. Can it affect your heart? And what? Oh my goodness. Yes, yes, yes. And let me just pause on that. And what's so funny about that is at the hospital, even though we're standing there shaking our finger at most of the patients, if you go downstairs in the lounge, they got Monster. If you go to any nurses station, they have Red Bull. So I mean, it's very common for us to say something and not do it. Thank you so much for giving me that information. I wasn't even aware of that. But absolutely, Red Bull. So okay, so let's talk about the different. First of all, cardiac arrest is the arrest. However, cardiac pathology does not start with the arrest. The heart normally kind of like starts to knock on your door about 2 months before. And it does it in such a subtle way. It may be just a little tingling, or it may just be short of breath, or you may get a cough, or you may be choking, or you may go to the gym and you may embark on an exercise that normally you don't get dizzy, and now you get dizzy. I don't know if I mentioned shortness of breath. It does little things. You may get muscle weakness because you got to think the heart is the hub. All the blood that goes from the top that feeds the strand of your hair that feeds your toenail goes through that little machine with only four chambers. And the slightest thing is actually kind of a miracle. The way that the heart does what it does. Hey, Edwin, how are you, dear? How are you? Thanks for stopping by. It's actually a miracle the way that the heart just does not let us down. And it could beat until we're 100 years old. When we say I want to live until I'm 100, but that means that your heart has to beat until you're 100. Are you treating your heart fair so that your heart can go there with you? And like I stated, I know that insurance is a main factor, but also taking ourselves for granted. When you're relatively healthy, you kind of take that for granted. Like me myself, I caught myself with that. I was taking it for granted because I'm not on any medications, and I'm like, but then knew dealing with my mother's new onset Alzheimer's. That's why I took off work because I knew I would not be able to mentally deal with my mom and patients and a commute. So I had to sacrifice. You're gonna have to reassess your life and just see if there's something that you may need to sacrifice. And you cannot accommodate everyone. As far as the influencers, if you can't do a show, people would rather see you here than to see you with consistency and you're not here anymore. And yeah, I never watched his show because I knew, of him and I respect him for being a content creator, but I just can't sit and just listen to someone um, say derogatory things about women. I just couldn't do that. So I didn't know anything about the Red Bull. But if he had to drink Red Bull during every single show, that means he must have been exhausted before he went on the show, or he drank the Red Bull to give him energy for the show. I don't know. But yes, sweetheart, Red Bull definitely can contribute to a tachycardia. Now, if your heart goes too fast, you ever been like, driving your car and you're driving so fast it's hard for you to put on the brakes. If your heart goes too fast, it can go into an irregular rhythm. And if it goes into an irregular rhythm, and if it doesn't kick back into the rhythm that it needs, you have something called SA nodes along the way. Hey, hey, hey. It's you ever like speed bumps. You have things that, but if it can't be triggered back, it can like go into a flutter. And once it goes into a flutter, especially if you live alone, unfortunately, death is usually more frequent for single people because there's no one there, right? And most people that are married, the spouse will be like, honey, you need to go get that checked out. You have no idea how many people come into the emergency room. Like, the only reason I came is because my wife made me. I'm like, well, you better be glad because take them straight to the cath lab. So, absolutely. Let's see. Which valve in the heart separates the right atrium from the right ventricle? So there's a bicuspid valve and a tricuspid valve. So on the right is the no, on the right is the tri, and on the left is the bi. So basically, it's basically just a valve. And some people are born with congenital pathology with regards to the valve. We don't know, right? But we do know the main thing that I'm pointing out is once you get over a certain age, do not take your good health for granted. Maintain a relationship with a doctor. Now, I know that there are ways that we could do EKGs from your cell phone. And I don't take insurance, but I do have like payment plans, and I help people with things that they can't afford from me to get it from somewhere else. Because the main thing that matters is you staying alive. Now, the main thing that we have to also take into consideration is everything that's going on in the world is definitely affecting us hormonally. And I know it sounds like, oh, my hormones. It's a really big deal, guys. It's a really big deal. It's imperative that we eat a certain way. The food is decreasing our longevity of life. The food that is made with toxins and the pollutants. So I could go into that, but the main reason why I really want to jump on here is I didn't want to come from an angle of some of the other discussions because there's plenty of information out there that you guys will be able to get from them. I just really want to emphasize the importance of preventative health. Just because we're living in a time of inflation, that doesn't mean you're going to be able to meet every deadline. Take care of yourself first. It is imperative. If you have someone in the home who is stressing you out, you're going to have to take a walk, you're gonna have to get away from it. You cannot internalize what's going on because have you ever like had to pass gas and you couldn't pass gas? You maybe ended up burping because it's got to come out of somewhere. So that is the same thing with regards to your heart. Um, have you thought about direct primary care where people charge? Yeah, you know, we have memberships, dear. We do, Sydney. We do. We do. That's what I'm saying. Yeah, the only problem, Sydney, thank you so much for bringing that up. We do have memberships, but the main thing is that with it being I do functional medicine, most of the people who we do memberships with are mainly coming in on the functional medicine. But Sydney, you're right. I need to make it a little bit more publicly known that I'll do just one-offs and we could do as far as a membership. Thank you so much for that. Absolutely. So that was it, guys. I just really, I just wanted to put a different angle out there in a blend of everything and just let it be known, guys. Listen to this. With the introduction of antibiotics and surgical intervention and a lot of things, we as humans are projected to live longer than we used to in the past. However, post C, we have a lot going on that was not anticipated. So that Gaussian curve could go the other way. Let's respect what just happened or is still happening because we're still coming into another winter. Rest, meditate, drink water, calm down. If you feel something, another good way of dealing with stress is to write. I do it all the time because when you're writing, you're getting it out. So you have to get it out some kind of way. Let's think about Kevin. If he had a controversial plot, can you imagine some of the things he had to read in his comments? I couldn't imagine, and that had to hurt, especially if he was still single and if he wasn't with anyone. That hurts. I don't care what kind of a facade he put on. He has feelings that had to have hurt. So he's internalizing that. He's tired. He's drinking Red Bull you know? So RIP to Kevin Samuels. And, as far as me being more of a influencer to you guys, I it was very difficult for me to jump on because of my mom, but fortunately things are getting a little bit more calm. I got about 3 videos actually that I was editing that I'll be putting up. So I'll be putting up more content. I'm gonna do definitely what Sydney said. I'm going to go ahead and activate a resource where I will be able to make it known that I have acute services. Just go and just get your blood pressure checked. Just go and get a random EKG. If you see any kind of health vans, just go and get a screening. If you're at a certain age, just get the test. The doctor is not just to go to if you're sick. It's called preventative care. There are certain minerals and supplements that as time goes on get depleted and they are not available to be replenished in our food. We have to take supplements for certain things. You got to trust somebody on this topic. And the supplements that you take, they have to be of a certain quality. And that's all I say. I just that's all I can say. Your primary care allopathic doctor, if they haven't had additional training in functional medicine or integrated medicine, God bless them, but they don't know to tell you because they don't know. But that doesn't mean that they are not bright, but they just don't know that aspect of medicine. As I know, some of the other functional medicine doctors know. Check the credentials of the doctors that you go to. Nurse practitioners are awesome if they are qualified, I highly recommend them as well. Just make sure you see someone on a regular basis and just take care of yourself and don't take your health for granted. What'd you say, Edwin? Yeah. No, no. You know what? I haven't been live lately. I mean, I've been on there every day, but I haven't been live lately. So maybe I'll go live tomorrow. I'll go live tomorrow. So, oh, what is functional medicine? That's a great question. So, functional medicine is like it basically looks at the person as a whole. So, like let's say you go into the doctor and you say I'm depressed. And but mainly that could be something that happened when you were 6 years old, or it could be secondary to something that's going on at your job, or it could be secondary to something that's going on, with the medical condition that's not present now that was present that we need to keep an eye on. So functional medicine looks at the whole person. We look at your mental health, your physical health, your family, your home, the health of your family, and we take all of that into consideration. So you may come to me and you may say you're having a hard day, and I may say something like, what's going on with your 7-year old? How'd he do in school? Because that could affect you. So we look at the whole person, and then we treat you not necessarily with, you know, allopathic medicine is treating symptoms. You come in with a headache, we give you an aspirin. So functional medicine is getting down to the root cause of what is causing the presenting symptom and giving you lifestyle modification to fix that, which will fix the symptoms. So usually we kind of like almost change your whole life, your eating, your sleeping pattern, your peace of mind, your holistic peace. We look at you as a whole. So it's a overall functional medicine. Basically, I feel like all of the areas of medicine are required in order to help an individual. Naturopathic medicine, functional medicine, allopathic medicine, and osteopathic medicine. Unfortunately, we are all kind of like scattered all over the place. So, outside of my allopathic training, I decided to go get additional training in functional medicine because I was already doing hormonal medicine. And I feel as if I give much better care now that we can talk about your husband, or we could talk about your job, or we could talk about the things that are really bothering you. We also look at your genetics because even though we think that some genes are bad, some of the bad genes are good because they are adaptive. So your body made some of the bad things to protect you from the diet and everything else. And we can change your diet and your behavior to kind of suppress or kind of like almost reformat your genetic makeup. So we look at your gene expression and we just look at you as a whole. So that's what functional medicine is. Do you have a website where people can book consult? Yeah, absolutely. So I'm basically what you can do is mainly I'm working on my doggone website. That's what keeps on making it so delayed. They're all done actually, but I have them where they're inactive, but you could always what I'll do. Thank you so much for that suggestion, Sydney. The link in this bio, I mean in the bio of this video, I will go ahead and I will put a link that you could call. I have 24/7 answering service. We take calls all night and all day, and you could talk to someone and they will get you in to be seen. And I guess I better go ahead and just get my site back up. I just was putting some different stuff on it. I've been on AppSumo lately, so but yeah, thank you so much, Sydney, for just mentioning that. I guess I should go ahead and just get my site back up pretty soon. So that's a very good question, Sydney. So how often should someone now my doctor, after you get a certain age, you need to see a doctor. Okay, so let me just answer your question generally. Everyone should have a baseline evaluation by a doctor. Now, unfortunately, with the Western diet being as it is, children are being diagnosed with hypertension, diabetes at like 8 years old in grammar school. So that means that these children are going to be having chronic medical conditions while they're in preschool, while they're like in grammar school. So we used to say once you hit puberty, like once a woman starts menstruating and once a man goes through puberty, you may want to go ahead and start going to the doctor on a more regular basis. But now, with it being that pathology comes at a younger age, I would pretty much say that you should start going to the doctor just there is really no start time. Just go. If you haven't gone, go. Now, once you go, normally if you're healthy and everything is found to be normal, and if you're living pretty much, like a clean life, I think that it's okay. It's acceptable for you to be seen annually. However, if you do have pathology, you do want to follow the recommendations of your doctor. I pretty much go in every 3 months because I'm playing catch up. Being transparent with you guys, when I was in my office, I was not going to the doctor because I went to my office when it was dark and I left when it was dark. And when I got home, I was like, I have so much to do, yada, yada, yada. So, believe it or not, the main thing that got me back to going to the doctor was after my office closed and after I started caring for my mother. Because I was like, how can I be here for my mother if I'm not caring for myself? So I'm not sure how old you are, Sydney, but I would just go as far as to say if you haven't gone, just go. And if you don't have insurance, which could be a very strong factor, and I respect that, a lot of money has come available post pandemic. Like the Medicare guidelines, they have trillions. And I don't know if it's from PPP loans or people not picking up their stimulus checks, but there is a lot of extra money. The government is respecting the fact that there's a lot of underlying or newly introduced pathology post the pandemic, mainly psychiatric, like Medicare. They're now covering substance abuse. They didn't cover that before. So if you don't have insurance, I would say if you go online, if you go Google, and if you put in government grants for and in space, you'll be surprised all of the money. They even have money to help you with gas. So I feel like even though preventative health is not covered by, I mean, even though it's something you normally should have to have insurance, I feel like there may be some ways right now in the times we're living that you may be able to be seen by a doctor. I can't guarantee this, but I'm feeling as if this is likely a possibility. So that's pretty much about it. Um, well, I just want to make myself as a just a different variety of the things that you guys are hearing, and just let you know that we got to respect our health. She's doing great. She's doing great. We're looking forward to Mother's Day. So we're gonna have a good Mother's Day. She's actually been dealing with like some pains in her hand. So I'm actually gonna have her in the pool so that we can do some like resistance exercises, and hopefully that will help with her joints. She's gaining weight, so she's doing real good. Yeah. All right. Well, love you all. And if you just want to hear, like, this platform is mainly where we talk about aesthetics, preventive health, hormones, and then we have a couple of others. White Copreneur, that's where we talk to you about making passive income. If you have the white coat on, pick up an extra shift, or you don't have to pick up an extra shift. You could pick up a link, pick up a blog, spend time with your family, and then Body by Test MD, where we talk fitness. So that's that. Hey, how's it going? Thanks for stopping by. Um, really? Okay. All right. Oh, okay. Very good. Very good. Very good. Very good. So, basically, what he is some cardiac past history, and it's quite significant. I mean, to have 5 bypass surgeries. So basically, we have the blood vessels in our heart are called the coronary arteries and the coronary veins, and sometimes they could get blocked. And if they do get blocked, that means that that part of the heart is not receiving blood. And if he says that it was the widowmaker, it was likely the LAD that was obstructed. And the reason why they call it the widowmaker is based on the way it sounds. Usually it will make the wife a widow because it normally will, you know, kill the husband. So he's very fortunate to still be here. Now, this is what I do want to tell you. I don't know if you guys remember, like, when Bill Clinton, was that his name? Bill Clinton, the prior president. You remember when he was having those cardiac problems and changed his diet, and after he changed his diet, basically we didn't hear anything else about those cardiac problems. He switched over to the Mediterranean diet, and we do have a meal plan system that's gonna be starting soon, and that is one of the diets I will have available, and it's not what we think. We can use oils, olive oil, we can drink wine, we can eat fat. The problem is that the message has been confused and we really don't know what we should do and what's good and what's bad. And that's the main reason why I'm going to do everything didactically for us so that it can be just more so black and white with references so you guys can go back and you can verify the information I'm giving you. But this gentleman who has had multiple bypass surgeries, there's a possibility that he still has stents in place. This is a very delicate situation. And I don't know how old you are, but sometimes our cardiac pathology is based on our family. So a lot of times cardiac pathology is hereditary. I mean, we'll have people that will come in their 20s and they'll have a bad heart, but that's hereditary. A lot of those people are called vasculopaths. So that just means that all the blood vessels in their body are pathological. We also are very familiar with like the healthy football player who's running across the football field and just drops dead, cardiomyopathies. So, guys, I'm telling you, we take this little guy for granted but he's a big deal. And if he decides that he just wants to leave the building, so do we. So we have to respect our heart and we can't ignore things and we can't take Mr. Hart for granted. So when I do complete the description box, I will put as much information as I can. I'll definitely put a resource if you guys want to speak in regards to this topic. And just follow us because it's such a coincidence. I just posted on TikTok, I'm going to make you save your own life. And we have been talking a lot lately about changing our diets, the addiction to sugar, and just eating better. So this, just would happen to come along. Yes, it is. It is. It is. And that's a very good point. A CPR training, but it also goes, I mean, this is me kind of like putting my beliefs on people, and I don't mean to, but my mom's illness definitely expedited the importance of me getting remarried. I was going to, but I was putting it off, but I recognize the value of a family. You can't do CPR on yourself, Sydney. And unfortunately, I think that he was still single and the married people live longer because it's gonna be someone there. In my building, there was a gentleman who was found dead in his unit. He had been there for 5 days. He was single. So, I know "Oh, I could do this by myself. I'm a strong person." That's beautiful, but we need a significant other for more than just financial or for more than just sex, for companionship and kind of like to be your wingman. So I just really, really, really strongly emphasize that we bring back the family unit so that we could all stay here a little bit longer and have someone watching out for us. You're 63. Wow. Oh my goodness. That's a beautiful thing. That's a beautiful thing. Congratulations. You definitely went past that one. Yes. Absolutely. Yeah, so, that's it. So like I said, if um let me see. Uh you know what? I wanted to make people happy. I that's I just I looked at it like I've had some patients, Sydney, that like when they would look in the mirror and they didn't like what they saw. And they were like, "Well, if I don't like what I see, why should I lose weight? I'm ugly," even though they weren't, or "Why should I do this? Or why should I do that?" Right? Once they started like losing weight, because they start no, once they got aesthetic procedures, they were like, "Oh, I look cute. Well, let me go ahead." Then they would start taking their medication. And I was like, wow, so when people feel good about their aesthetic, it's kind of crazy, but when people feel good about the way they look on the outside, they're willing to take care of themselves on the inside. And the I like the response. At first, I was going for plastic surgery, but that was just like taking too long. And then I more so wanted something that was acute, where I could just address them. Less than 25 cc's of lidocaine. You're in, you're out, bada bing, bada bang. So that's why I chose aesthetic procedures, outpatient aesthetic procedures. Absolutely. Yep. So, all right. Well, I hope that I've, kind of presented some information in a positive light, and we just kind of like look at this as it's no longer just cancer, it's no longer falling out of a building, it's no longer getting shot, it's people just boop dropping dead, so hopefully this is hitting a little bit more closer to home, and we're just respecting preventive care just a little bit more. So, well, I'm Dr. Tess. Thank you so much for stopping by Tess MD TV. Be sure to subscribe, tell your friends about the station, come more often, and look forward to hearing fresh new content to keep you on this earth, hopefully, a lot longer and off of medication as long as we do lifestyle modification. All right. Love you all. Take care.